dentistry probably is the only profession, and I say it with full responsibility. Dentistry probably is the only profession which skills you enough in 5 years for you to be self-employed. The negativity built around is coming from the fact that we have not skilled our students enough with the confidence that all you need to do after you have finished your dental school is to go out and set up a dental practice. No, dental practice setup is very expensive.
Yes.
No.
This is the one point.
No.
Yeah, okay.
But then you just don't get into it for the heck of getting it. If you like research, spend your life into it.
Those are the perks you will get.
Oh, those things will come. Money will come. Take it from me, money will come, money will follow you. You are in probably one of the best professions. I'm not saying that because I'm a dentist myself. I'm saying that because I have seen my peers.
But sir, rather than comparing, we can say that if the branch of dentistry is existing in our society, don't you think there must be a need? Right.
What you are doing is trying to get few recognizable faces on board, on air. When people would watch this, they would understand that this is what dentistry can actually do to the personality and to the life of an individual, and taking him to a place where probably not many other professions could even think of. But if I have to relive my professional journey, will I take dentistry again? Certainly yes. Dentistry is going to be my first choice this time around, and I'll be a happy dentist, a chosen profession.
Hello and welcome to India's most famous dentist. I am Dr. Karthik and welcome to the second episode. In today's episode, I will be having conversation with Dr. Ashish Jain. Dr. Ashish Jain is a periodontist who finished his BTS from a dental college called DAV Dental College, Yamunanagar. After his graduation, he did his masters from Nair Dental College, Mumbai. मुंबई से लेके बॉस्टन तक की डॉक्टर आशीष की जर्नी से इस एपिसोड की शुरुआत की। डॉक्टर आशीष ने अपने लाइफ के हर पहलू में एक्सेल किया है। मैं कुछ एग्जांपल्स आपको देना चाहूंगा। अगर आप डेंटल स्टूडेंट हैं तो आप जानते होंगे कि हमारी पेरियो की एक गोल्ड स्टैंडर्ड किताब है, मैं नाम नहीं लूंगा। उस किताब के डॉक्टर आशीष एडेप्टेशन एडिटर रह चुके हैं, और ना ही सिर्फ एडिटर, उस किताब के कुछ 6 से 7 चैप्टर्स में भी डॉक्टर आशीष का कंट्रीब्यूशन है। 60 से भी ज्यादा पब्लिकेशंस एज वेल एज कुछ 650 से भी ज्यादा साइटेशंस डॉक्टर आशीष के नाम है। और इतने लंबे टाइम तक एक ही फील्ड में आप एक्सेल तभी कर पाते हैं जब आप इस फील्ड को एंजॉय कर रहे हैं। तो ये सारी बातें आपको इस एपिसोड में मिलने वाली है। आपकी लाइफ में बहुत सी वैल्यूज भी ऐड करेगा, एट द सेम टाइम ये एपिसोड आपको इंस्पायर भी करेगा। व्हाट आर यू वेटिंग फॉर? जस्ट गो, ग्रैब योर पॉपकॉर्न्स, सिट बैक, रिलैक्स एंड एंजॉय द शो।
It's all about teeth. Presenting to you India's most famous dentist with Dr. Karthik, powered by Karthikatva.
Hello sir, welcome to the show.
Thank you very much.
How are you doing sir?
I'm doing very well, thank you.
Sir, don't get me wrong, लेकिन my eyes were on you since I was in third year. मतलब हमारी एक फेमस किताब है, हम पढ़ते हैं, मैं बताऊंगा नहीं कौन सी, पेरियो की है, आप देख लेना, उसमें सर की फोटो है। सर, सबसे मैं देख रहा था कि आपसे एक बार मुलाकात करनी है मतलब, और आज हो गई। तो सर बहुत सी बातें करेंगे आज हम। आज मैं बात करने वाला हूँ कि स्टूडेंट्स, हाउ कैन दे एंजॉय देयर फील्ड of dentistry as well as how can they excel in their field at the same time. लेकिन वो सारी बात करने से पहले कुछ आपके बारे में, आपकी जर्नी, आपके शब्दों में जान लेते हैं।
Thank you very much, Karthik. It's a pleasure to be here.
and more so for the reasons that you really want to do all this.
Sir.
We'll be very happy. I'll be very happy if out of this, few students get inspired, so as to say. But yeah, coming back to your question, मेरी जर्नी कहाँ से शुरू हुई? सो मेरी जर्नी शुरू हुई एक छोटे से मिडिल क्लास फैमिली से, like everybody else. My father worked for in a government job. As anybody else at that age, when you're in 10th, 11th, and 12th, you have the dream of being a doctor. And whenever you would say that I want to be a doctor, dentistry at that point in time was not your priority. Dentistry is probably at this point in time also is not a priority. However, so I did not get medicine. I could not get into MBBS. So I was pushed into BDS like anybody else even now.
Right, sir.
And that was in 1989, long back.
Okay.
I took admission in a college in a very small town in Haryana by the name of DAV Dental College. And I graduated from there in 1995.
Okay.
After that, of course, आगे क्या करना है, तो आगे उस टाइम पोस्ट ग्रेजुएशन का बहुत चलन नहीं था, बट स्टिल पोस्ट ग्रेजुएशन पीपल वुड वांट टू डू. सो उसके लिए फिर ऑल इंडिया एंट्रेंस होता था. ऑल इंडिया एंट्रेंस की तैयारी करी, बहुत लग के साल भर तैयारी करी, एंड फॉर्चुनेटली आई वाज एबल टू क्लियर ऑल इंडिया. और वो ऑल इंडिया क्लियर करके मैं एक छोटे से शहर से निकला हुआ, जन्मा पड़ा, पहुंच गया बॉम्बे. So Bombay I did my post-graduation from Nair Dental College in Bombay. And that is where the entire outlook to dentistry for me changed.
Right, sir.
Bombay was the place where I got in touch with who's who in dentistry at that point in time. And that's when I realized that dentistry certainly is not as bad a profession as it was made out to be. People in dentistry in Bombay were doing fantastically well. They were roaming around in probably best of the cars. The dentist, the who's who I could get in touch with, were treating the who's who of all the glamour industry that you talk about. And that's where I realized that dentistry has a lot of potential in it. Anyhow, so I finished my post-graduation in 1999. And 1998, sorry. And after that, and worked very hard, like any young boy would, who wanted to make something out of the profession. And after 1998, I got in touch somehow with Professor Van Dyke, who was at Boston University at that point in time. He had come to India for a conference in Chennai. So my godfather, Dr. Kumar Swami, introduced me to Dr. Van Dyke. And then with Dr. Van Dyke from Chennai, I spent 3 days with him, taking him to Agra and all that stuff. Right. And that's where I realized what international dentistry is all about.
Okay.
So I really pursued him. At that point in time, I realized that if I have to really stand apart in this profession of dentistry, the West is probably the place I need to go to and get trained myself into, further things that dentistry had to offer. Anyways, cutting long story short, so I was given an opportunity to work with Professor Van Dyke at Boston University as his postdoc fellow. That was in the year 1999.
Okay.
And I still remember the first flight out of Delhi to Boston was my first flight ever.
Okay.
So, and it was an amazing experience. And the day I reached Boston, Dr. Van Dyke, along with Dr. Alpdagan Kantarchi, a Turkish guy, a beautiful, great friend of mine now, both of them were there at the airport to receive me. All of a sudden a guy coming from Yamunanagar and then spending some time in Bombay, and all of a sudden you are sent to a place like Boston, and then he was there to receive me, and he was there in his car obviously, and that was the first time I sat in a convertible car also, because he was driving a BMW convertible.
You actually got the glamour.
So now dentistry was unraveling. I could understand that this is Dr. Van Dyke is a dentist after all. And so I had a beautiful tenure with Dr. Van Dyke for almost an year and a half. And that's when a friend of mine who was an Indian, was at Boston University doing her master's there. She came to us, came to me, saying that there is an ITI scholarship available. They chose around at that time it was 8 scholars from all over the world, and they were sent for 1 year to the chosen centers.
Okay.
So she said that you should apply. It was a very ambitious thought for her to think that I probably was a suitable candidate. Anyhow, she forced me to apply, and I did apply.
Right.
And when you have to fill in the center, I filled Harvard University as one of the centers there because that was a listed center for ITI scholarship. And I applied. I just applied for the heck of applying it, knowing definitely, surely that I'm not going to get it. I mean, you cannot be amongst the top eight in the world to get a paid scholarship. So it was not happening for me, and I was very sure about it. Anyhow, but because Harvard was in Boston, I was in Boston with Boston University at that point in time. So I wrote an email to Professor H.P. Weber, who was at Harvard University heading the implant program there. It was basically on implant fellowship.
Right.
So I wrote an email to him. I said, I'm in Boston here, and if you can spare some time, I have applied for this scholarship, and if you can spare some time, I'll come over and meet you. He said, all right, you come over. But I'll have, say, around 20 minutes for you. I said, fine. So then I went there to his office at Longwood, at Cambridge, where the Harvard School of Dental Medicine was.
Okay.
And we started chatting. And that 20-minute, believe it or not, that 20-minute extended to almost close to an hour. And we were enjoying our discussion. We as Indians like to speak a lot about ourselves.
Yes.
And that's exactly what I did. But we enjoyed the discussion.
Right.
And 2 months down the line, I received an email that, congratulations, you have been selected for ITI fellowship at Harvard School with a $30,000 worth of scholarship. I mean, I had to read it.
Top 8 students.
Top 8 students.
My
I had to read it like 10 times to see what was written in it. And of course, I called up immediately back home and then, after that, I went to Harvard, spent a year working with Professor Weber, having graduated from India in Perio. There was absolutely zero implant experience. And here I was at the Makkah at Harvard, into the implant department and looking, seeing, watching, eventually doing implants with probably the best hands and the brains in implant dentistry that was available at that time. Professor Weber, Professor Myron Nevins, Mark Nevins, you name it, and they were there. And that was a beautiful experience, wonderful experience. And then I finished that and then came back to India in 2003. Because I was on J1 visa, and J1 visa had a 3-year, it was valid for 3 years, extendable to 3.5 that I got. But after that, you had a 2-year home country requirement. So I came back to India, and I had to come back to India. And then 2005, me and my wife, so in the meantime, my wife had also joined me there. So me and my wife were called back to Boston University for an interview of faculty position there. So we went there.
Sorry to interrupt you, sir.
Sure.
Arranged marriage or love marriage?
No, it was my wife was my girlfriend all these years. We met in Yamuna
Nice.
and 1989 was my first year. 92, it's getting personal, but so be it. In my second year, I proposed to her and she refused.
Okay.
But then, a year and a half later, So we had a
Thank you for
great
sharing,
time,
sir. Yes, sir.
and we are beautifully married now
Together. Yes,
for
sir.
many years.
So,
So we were called back to Boston in 2005 for an interview with Boston University Dean, and both of us were offered faculty position. But between this 2003 and 2005, when we were back in India, we realized that India is the place to be in.
Okay.
Reason for that was that because India at that the dentistry in India at that point in time was actually blooming, was actually exploding, not even blooming, was exploding at that point in time, and we realized that this is where we have to. So, despite getting a wonderful faculty position for both of us at BU at Boston University, we decided to come back. Come back. We said thank you very much. We are really appreciative. We are appreciative of them even now for having considered both of us for faculty position, which really does not happen too often. And then we came back, and we are enjoying ever since.
So, what was the motivation behind flying to US?
Reason for me to go to US were probably two. One was that the thought that you can actually go there with the kind of background that we had was a very inspiring, was a very burning, aggressive thought in me. But more importantly, that postdoc fellowship was coming with $25,000 worth of stipend with it,
Right.
and 25,000. Okay, so I was working as a lecturer in a college in Solon at that point in time, earning say around 10,000-11,000 rupees per month. I'm talking of way back 99, 90.
In late 90s, right? So,
No, 99, 2000.
19, okay.
And I was offered a stipend of $25,000 a year at with Dr. Van Dyke, which he very gladly agreed to increase to 30,000. So that was actually turning out to be 10 times my salary. So we thought this is probably the best place to go. But sometimes fate makes you take decision wherein you don't really think too much, or you think the other reasons to take the decision, but eventually all those pieces fall back in place, and later on you realize that was probably the best decision that you have ever taken in your life. And that happens to me for going to Boston.
I just wanted to ask, this is for our students, especially regarding to dentistry, that how to enjoy and excel the way you did at the same time in the field of dentistry.
So I think to enjoy and excel, the first thing is to accept.
Okay.
Okay, so we understand, and if I convey this to anybody today, that dentistry is great, wonderful, people have made good careers out of it, see examples all around, so start thinking about being a dentist. That probably is not the right track to say. Okay, but still people get into dentistry.
Right.
Few of them gladly, majority of them forcibly.
Right.
Okay, but having gotten into it, you have to accept it. Once you accept it, and I'm not saying accept it with a regret, you get into this profession, you look around, see what this profession has to offer. And today, if you ask me, I can spend next 15 minutes on comparing a medical and a dental profession and tell you why dental profession has been the best choice, should have been the best choice, and should be the best choice for anybody who's aspiring to be a doctor.
But sir, rather than comparing, we can say that if the branch of dentistry is existing in our society, don't you think there must be a need? जो हमारे पहले के लोग थे उन्होंने देखा होगा कि नहीं ये ब्रांच की ज़रूरत है, then why we keep on comparing with medicine? Dentistry is an individual branch in itself.
Excellent. It's a great thought line that you have taken. If you look in the West, there the dental course or dentistry is not a filter of medicine. There the student or a prospective student looks at dentistry as a profession which is independent of a medical profession. So there you have people who would want to be dentists.
Exactly. Can't we have the dream of becoming a dentist? I just want ki chota bacha bhi bola I just want to become a dentist.
Yeah. Things have changed a lot.
I'll
share. So when I got into BDS, not was able to get into MBBS, I went to one of my friend's place, my best friend at that point in time. So I went to his house as we would go. So his father asked me, "What have you got?" I said, "I've got dentistry." So his answer was, and I'm talking of 1989. His answer was, "चलो अच्छा है, job तो मिल जाएगी."
हाँ.
Okay. So that was the mindset at that point in time, because at that point in time it was still a filtered out profession. Those who are not able to get into medicine got into dentistry. Unfortunately, within our country, that thought process still continues.
Okay.
To a certain extent. That, okay, my child has to be a doctor. No parent would say, okay, my child has to be a dentist.
Right.
No child would say, I want to be a doctor, meaning I want to be a dentist. And the reason for that is because that is how the dentistry has been projected to them.
Right.
What you are doing is trying to get, few recognizable faces on board, on air. When people would watch this, they would understand that this is what dentistry can actually do to the personality and to the life of an individual, and taking him to a place where probably not many other professions could even think of.
Exactly.
And that is where the perception would start changing. So to students, if I have to say, until and unless you have a strong urge of burning those midnight oils, not only to do your medicine, but also after you have finished with your medicine, then certainly medicine is where you should be. But if your urge, your aim, your gap in life is to serve the people, give them better health, there cannot be a better profession than dentistry.
Right, sir. Right, sir. Sir, why this negative projection is present in the society? You please. I no offense, like मैं किसी को मतलब ऐसा बोलना नहीं चाहता. It's just for the awareness, और कहीं ना कहीं ये वैल्यू ऐड कर रहा है, तो हम इसी पे ही बात कर रहे हैं. तो मतलब कोई अपने पे पर्सनल ना ले. It's just the discussion we are.
Yeah, absolutely. Absolutely. And this is the truth. This is the truth, actually. This negative perception is because we look at dentistry negatively. What is happening these days? Students are getting into dental schools, into dental colleges. By the time they graduate out, they are around 21, 22, 23. Majority of them are girls. Not because they want to do, because girls want to do dentistry, but majority of the girls, and that same is true even in a medical college or a dental college. They are more studious. Let us accept it, boys. They are more studious. They are more studious. And that's how they get into a medical or a dental college. So this girl is now 22, 23 after she has finished her BDS. As a parent, and I'm a parent of a 23-year-old girl, as a parent, you would think another 1 year, 2 years, start looking for a boy. If she has not already looked for one for herself, start looking for a boy and get her married off by, say, 25, 26. That means 2 years, 3 years is what is left.
Right.
अब 2-3 साल के लिए क्लिनिक डालना तो बहुत मुश्किल है. So क्या करें? Let us find a job. Dentistry was never supposed to be a job-giving profession.
Right.
You have a 1,000-bedded beautiful hospital in the town, and how many dentists would that employ too? Because that is the requirement.
Right.
If you really ask me, dentistry probably is the only profession, and I say it with full responsibility, dentistry probably is the only profession which skills you enough in 5 years for you to be self-employed. Name any other profession that you can, which can actually skill you enough so that you are self-employed. I'm not talking of startups as self-employed, where you are self-employed after 5 years. Dentistry is the only profession that can do that. Along with this, tell me one dentist around you, look around you, tell me one dentist who is not comfortably moving in one of the better cars around.
Exactly.
What I'm trying to say is,
sir. Perfect.
it is easier. So essentially, the negativity built around is coming from the fact that we have not skilled our students enough with the confidence that all you need to do after you have finished your dental school is to go out and set up a dental practice. No. Dental practice setup is very expensive.
Yes.
No.
This is the one point.
No.
Yeah. Okay. Right.
If you really dissect the capex that is required to set up a dental practice, if you are asked to open up a garment retail showroom, it is not even half the cost that you will be able to put up a dental practice.
Right. Okay.
You're getting married after 3 years, that's fine. Pick up your chair, pick up your x-ray, pick up your RVG, pick up your sterilizer and go wherever you are getting married. The only thing you're losing out is probably on some of the finishings and fittings that you have done. That's about it. The problem is that we are not letting this thing pass on to the students. We are not making them confident enough. We are not giving them enough of management mantras so that they become confident to get into self-employment right after their graduation. And the moment that happens, you believe me, dentistry is going to be one of the most sought after. You become self-employed at the age of 21, 22, 23. You have life with you.
Right, sir.
You can do wonders.
Okay. I just wanted to ask, or I just wanted to add something to it, that what should be the approach of a newcomer, or we would say a beginner or a professional who will be spending nearly about 35 to 40 years in this profession if he is just running behind money?
Good point. I was thinking the same.
Huh.
When I was young, money was important. Okay, but at that point in time, a very senior dentist, Dr. Anil Kohli, he told me once that stop running after money. Skill yourself enough, money will run after you.
Then and then only you will be doing good in research as well, because you will be knowing the requirements of the society.
Absolutely. So research, Karthik, is one field which not all will fit into. To be into research, I'm spending my life into research. I'm totally into academics. I'm not at all into private practice, private offices. But you need to have that temperament. You need to have that patience. You need to have that zeal in you. That research is what you really want to spend your time. I don't advise people to just follow research because research is glamorous. You have good paper, you are cited, and as you said, you saw a photograph in the book. I understand that. But then you just don't get into it for the heck of getting it. If you like research, spend your life into it.
Those are the perks you will get.
Oh, those things will come. Money will come. Take it from me, money will come, money will follow you. Don't run after money, run after skills. Enable yourself to do whatever you are doing in dentistry better than the dentist next door. And the patients are going to realize that. Patient can actually tell you, looking into your eyes, how confident you are for the procedure that you are going to perform on him.
Exactly.
And that confidence will come with the conviction, and that conviction will come with proper training.
Right, sir.
So train yourself well, run around, learn new things. Once you have done that, settle down, get into a practice. Sky is the limit.
Right, sir.
I can say is to wish all the budding dentists out there a wonderful career, a wonderful future. You are in probably one of the best professions. I'm not saying that because I'm a dentist myself. I'm saying that because I have seen my peers who are not dentists, non-dentists, performing what they have. Of course, there are few who are absolutely on the other side of the volcano. There are few who are on the other side of the volcano, but I have enjoyed doing what I'm doing. Dentistry was pushed onto me like anybody else. But if I have to relive my professional journey, will I take dentistry again? Certainly yes. Dentistry is going to be my first choice this time around, and I'll be a happy dentist, a chosen profession for me.
Thank you so much, sir.
Thank you
for being on our show. Thank you for your time, efforts, and energy.
Thank you.
Thank you so much.
कैसा लगा एपिसोड? आई होप ये एपिसोड ने आपको इंस्पायर किया होगा, बहुत सी लाइफ में वैल्यू ऐड की होगी. इस एपिसोड को आप जितनी बार देखेंगे उतनी बार एक नया परसेप्शन आपको इस एपिसोड से मिलने वाला है. तो इस एपिसोड को बार बार देखिए, अपने आसपास के लोगों को, अपने दोस्तों को, अपने डेंटिस्ट फ्रेंड्स को जरूर दिखाइए. हम आपके लिए इसी YouTube चैनल पे ऐसे ही वैल्यू ऐड करने वाले एपिसोड्स और कंटेंट लाते रहेंगे. इस YouTube चैनल को सब्सक्राइब करना ना भूलें और आने वाले कंटेंट की सारी जानकारी हमारे Instagram हैंडल से आपको मिलने वाली है. तो इस Instagram हैंडल को आज ही जाके फॉलो कीजिए. You are watching India's most famous dentist. I am Dr. Karthik Dinoja, See you in the next episode. Till then, that's it from my side. Signing off.